carcinoma. Basal cell carcinoma are abnormal uncontrolled growth that arise from the skin's basal cells in the outermost layer of skin, epidermis. What is the basal cell? One of three main types of cell in top layer of the skin. Basal cells, said as new ones from basal cells, BCC, most often occurs when DNA damage from exposure to UV radiations from the sun or indoor tanning triggers changes in basal cells in the outermost layer of the skin, resulting in uncontrolled growth. Where it is usually found, this cancer most develop on the skin areas typically exposed to sun, especially the face area, neck, scalp, shoulders, and back. Basal cell carcinoma may appear as a peary or waxy bump, a flat flesh-colored or brown scare-like lesion, a bleeding or scraping score that heals and returns. Basal cell carcinoma can look like open sores and red patches, pink growths, shiny bumps, scads, or growths that slightly elevated. What causes it? Most basal cell carcinoma are caused by the combination of intermittent, intense exposure and cumulative long-term exposure to UV radiation from the sun. How many people get it? Basal cell carcinoma is the most common form of skin cancer, with more than 4 million cases diagnosed in the US each year. More than 1 out of every 3 new cancers are skin cancers, and the vast majority are basal cell carcinomas. The diagnosis and treatment of non-melanoma skin cancers, including basal cell carcinoma and squamous cell carcinoma, increased up to 7% between 1994 and 2014. How to spot basal cell carcinoma? 5 warning signs. Check for basal cell carcinoma where your skin is most exposed to sun, especially the face, ears, neck, scalp, chest, and back. But reminder that they can occur anywhere on the body. Frequently, 2 or more of these warning signs are visible in basal cell carcinoma tumor. An open sore that does not heal and may bleed, ooze, or crust. The sore might persist for weeks or appear to heal then come back. A reddish patch or on the face, chest, shoulder may have crust, itch, hurt, or cause no discomfort. A scar-like area that is flat, white, yellow, or waxy in color. The skin appears shiny and taut, often with poorly diagnosed borders. These warning signs may indicate an invasive basal cell carcinoma. How serious is it? While basal cell carcinomas rarely spread beyond the original tumor site, if you allow to grow, these lesions can be disfiguring and dangerous. Untreated basal cell carcinoma can become locally invasive, grow wide and deep into the skin and destroy skin, tissues, and bone. The longer you wait to have a basal cell carcinoma treated, the more likely it is to recur, sometimes repeatedly. There are more highly unusual aggressive causes when basal cell carcinoma spreads to other parts of the body. In even rare instances, this BCC can become life-threatening. Basal cell carcinoma treatment. Effective options for early and advanced BCC. When detected early, the most basal cell carcinomas can be treated and cured. Prompt treatment is vital because as tumor grows, it becomes more dangerous and potentially disfiguring, requiring more extensive treatment. Certain rare aggressive forms can be fatal if not treated properly. If you are diagnosed with a small early basal cell carcinoma, a number of effective treatments can usually be performed on outpatient basis using a local anesthetic with minimal pain. Afterwards, most wounds can be naturally healing and minimal scarring. Options include electrosurgery, Mohs surgery, excisional surgery, radiation therapy, photodynamic therapy, cryosurgery, laser surgery, and topical medication.